Namaskar everyone. On behalf of our WHO Collaborating Center for Emergency and Trauma Care for Southeast Asia region at JPNATC AIIMS New Delhi, I welcome you to the first session of our podcast series commemorating World Health Day 2024. Today's podcast, titled My Right to Save Lives, Advancing CPR Education Worldwide, is a testament to advocating for the universal right to quality health education. This aligns perfectly with this year's World Health Day theme, that is, My Health, My Right, championing equitable access to healthcare education, and information for all without any discrimination. As we embark on this journey, we will explore the critical realm of CPR education and training. Our aim is to explore innovative solutions and overcome the barriers in this field. I'm pleased to introduce Dr. Sanjeev Kumar Bhoi, the Director of WHO CSET and Professor at the Department of Emergency Medicine, AIIMS New Delhi. Dr. Bhoi will enlighten us on the significance of CPR and which is also known as the kiss of life in emergency situations. And so we would like to know from you why it is important for laypersons to acquire this life-saving skill.
Thank you, Neha. And it is a very important question, the importance of CPR. Why it is actually required. You see, remember this, if you want to save a lot of lives, saving a billion, the mission should be mission with a vision to save a billion. That is the key concept of, infusing life by this immediate life support skill that is called as the CPR, means cardiopulmonary resuscitation. It was invented by Peter Suffolk way back in 1950s. And he professed that by creating such a skill, we're able to save a lot of lives. The importance here is we know that there is a increasing mortality due to road traffic crash and other non-communicable disease such as STEMI, stroke, and other emergencies. And the culmination is the patient having the patient coming with arrest situation in the emergency. It is important also that if you want to really give CPR, it should be done as early as possible. I'll cite few examples is how important it is because 90% of the death occurs outside the hospital. And out of 90%, 70% occurs at the at the place where the person lives or nearby areas. And 20% of them they arrest while working in their own employments. Only 10% have got in-hospital deaths. It is important that when it is occurring, 90% deaths are occurring outside the hospital and the immediate life support skill is CPR. That's why it is important for everybody to learn the life-saving skills. So you can see where in the 90% of people when they're outside the hospital, they are non-professionals, yeah, non-healthcare professionals are available, such as bureaucrat or the lay persons who are there in the community. They are the first responders for any kind of emergencies, such as the tea vendors, pan walas, police walas, all these walas, you can say, are there are the first responder. But the problem here is there is no organized training of CPR to this community people who are actually the become the first responder. The importance here is if you see citing one important example is if you see the top leaders have crashed while giving speech. During speech, they suddenly collapse. Many of the top celebrities they have collapsed without getting a CPR, timely CPR to them. So a common man receiving CPR again is a huge issue. So that's why in this sphere, everybody should get trained, and so that we save a lot of lives. You see that it should be done as early as possible. Within no time, we should start doing chest compression, because 1 minute delay in giving immediate resuscitation or immediate chest compression increases the mortality rate by 10%. So that by 10 minutes, the game is over. And if you want to save life, within 4 minutes, the brain death also occurs within 4 minutes. So you should start CPR as early as possible. And you can understand the huge the huge significance of CPR for the community. Thank you. I hope it answers the question, Neha.
Thank you so much, Dr. Bhoi, for the insightful perspective on the importance of CPR for laypersons.
I'm pleased to invite Dr. Prakash Sinha, co-director of WHO Collaborating Center for Emergency and Trauma Care, Southeast Asian region, and additional professor at the Department of Emergency Medicine, AIIMS New Delhi, to shed light on the key barriers to CPR training.
As we already discussed, and Mr. Bhoi sir has given a great insight about the need. So largely, whatever population we cater, we wish to have our communities very much trained in these kind of life-saving skills. So जब भी हम लोग बात करते हैं कॉमन पॉपुलेशन में, तो व्हाट वी रिक्वायर, वन इज विलिंगनेस टू लर्न, वन इज विलिंगनेस टू लर्न. सो नाउ as the education is going up, people are becoming more aware. This part is a bit not that much of a barrier, but once they wish to get themselves trained, so kaha jaake training le, where they will go for getting trained, on what they will require resources like mannequins. So उसमें mannequins भी चाहिए, अच्छे trainers चाहिए, certified trainers चाहिए आपको. So these all things are required. You require a skill lab where you can go and get yourself trained. Like if you see motor driving के लिए, we have motor driving schools where you can apply, get a slot, and you can train yourself for motor driving. So likewise, they require a place where they can get trained, a trainer, and required gadget on which they will get trained. So that gadget, I mean कि जो डमीज होते हैं, मैनिकिन्स होते हैं, वो आपको रिक्वायरमेंट है, अच्छे ट्रेनर की रिक्वायरमेंट. So these are the common barriers. So apart from their interest, awareness, you require a structure or system to train them. You require resources. So these are the major, you can say, challenges or barriers. Over to you, Sai.
Sir, I would like to ask regarding the potential solutions to overcome these challenges.
See, as you are aware, हमारा जो WHO Collaborating Center है, so we are working in lines of community emergency care initiatives, and school CPR or a lot of training is going on. One of such training system or module is Satyam program, where we are training the school going and college going students on CPR and other immediate life saving skills. So that is one way we are trying to create a lot of trainers across country. So this is one, and many other people are also doing similar kind of activities. So we can utilize them for getting ourselves trained. Second is, can we get these skill centers? So now government is very much proactive, and we are working very closely with a lot of governments, state or central government, and all medical colleges. And in coming time, you will see district hospitals are getting converted as skill centers, but they are largely for the healthcare providers. For common people, our Satyam program offers a unique solution by making these colleges and schools self-sustainable by creating a internal system of training that means a certified trainer, an area with the requisite required dummies and mannequins. See, for escalating to common public, the dummies are major, you can say, barrier or roadblocks, because Satyam program is also coming up very soon on online model, where any person can log in, or वो log in करके वो videos देख सकता है, they can speak to us, and even they can practice while watching us online. But the real challenge is to coming up with simple solution of dummies or mannequins on which they will get themselves trained. So we have also done few of the you can say modeling on that regard. So like using the pillows, using other stuffs which are low cost on which we can train people. One of such innovative idea which is researched by one of our colleague, Dr. Rachana. So she had published this, researched it against. So she created a simple pillow and water bottle based mannequin, and she has researched and published her research in a world's reputed journal, where it has shown that while getting yourself trained on these low cost, simply available at homes, जो घर में आपको तकिया और बॉटल मिलता है, उस पर अगर ट्रेनिंग आप करें, इट इज नॉट गोइंग टू बी इन्फीरियर. वो जो बेस्ट मैनिकिन मिलते हैं आपको, उसके बराबर जैसा फील और आउटकम आता है. उसमें ट्रेन हुए हुए लोग दोनों को हमने देखा कंपेयर, उसमें बराबर है. So we'll know in great detail from Dr. Rachana also. So these are the possible ways by which we can address going to the schools, going to the colleges, and through these colleges and schools we can go to the masses, organized people like traffic, police, and other associations and resident welfare societies. So these are the ways by which we can escalate to a great detail. Thank you.
Thank you so much, sir, for your valuable insights.
Now, let us welcome our distinguished speaker, Dr. Rachana, who is an assistant professor at Kasturba Medical College, Manipal. She will be sharing her groundbreaking research on a low cost CPR pillow model and its profound implications for enhancing hands only CPR training globally.
Thank you, Neha. At the outset, I would like to thank WHO Collaborating Center, Southeast Asia region, Dr. Bhoi sir and Dr. Tej Prakash sir for giving me this platform for disseminating our research work further. And a second thing, it wouldn't be appropriate if I proceed without acknowledging my research team. One of the main pillars, Dr. Prithvishi Ravindra, my colleague, who has been spearheading CPR education in our institute, and my head of the department, Dr. Jairaj, who has given us opportunity to conduct this research. So proceeding further, I think from the days of my residency, our faculty members at AIIMS New Delhi, Dr. Bhoi sir, Dr. Tej sir, had taught us the importance of community training, especially in terms of a lot of emergency aspects, be it the basic trauma care or first aid or CPR education. Because CPR, all the emergency problems start from the community, and then emergency is an interface where the community comes in contact with the healthcare system. So when we started CPR training, one of the major barriers for us, especially when we wanted to do mass training, was procuring these mannequins or the dummies on which we train in CPR. So this was one thing which me, my colleagues, my research team, we wanted to work on. And that is how we landed up doing this study. Because whenever we use an alternate methodology of training, there is always a question of whether it is going to be appropriate or whether it is going to have the same efficacy as using a mannequin, like a standard mannequin, which is the standard method of training as of now. So that is how we started off with this study. So when we started the study, we've tried various things. Pillow was definitely one thing which we had read here and there in literature. We had seen few people suggesting that it could be used. But how can we give an experience similar to a mannequin using a pillow? So one thing which the mannequin has is, if the hand position, that is the hand position in the mannequin, is right. So whenever you're compressing, there is a click that gives a positive feedback, when telling the trainer or the trainee that adequate depth was reached and the hand position was correct. So this was one thing which probably we could not emulate with a simple pillow. So then came the idea of using a PET bottle or a plastic bottle in the position where otherwise we would anticipate the sternum and the click to be in the mannequin, which could probably simulate the click which is heard in the mannequin. So we tried with various different pillows. We used a cotton pillow, which is commonly found. We found that there is no good recoil. मतलब जो रुई के जो नॉर्मल पिलोज होते हैं, वो एक थोड़े साल यूज करने के बाद उसमें वो स्प्रिंग एक्शन जो रिकॉइल नहीं होता है. So then we tried with the पॉलीफाइबर पिलो, जो रेक्रॉन पिलो होता है या रेयन के फाइबर वाला पिलो, जिसमें थोड़ा सा स्प्रिंग एक्शन, द स्प्रिंग एक्शन वाज मच बेटर विद दीज पिलोज. सो like this we tried 2-3 things, and we felt that compared to a new cotton pillow is still better, but compared to an old cotton pillow, a rayon or a polyfiber pillow was better, giving a better recoil. Second thing is the bottles. So we tried with the empty soft drink bottles, which were slightly hard, so it was difficult to do the compression. And when we saw that the water bottles, the Bisleri or other brand water bottles, those bottles are not very hard. It is just adequate. And if it's well capped with the water bottle cap, that was giving us the perfect click and the perfect strength required for compression. That is the depth of compression when we are doing and how hard we have to compress. It was giving us a very good feedback. So we tried using this. How we did the study was, we took 2 groups of undergraduate students, college going students, who were not previously trained in CPR. तो CPR में जिनका पहले ट्रेनिंग नहीं हुआ है, उन्हीं पे हमने स्टडी किया था. We randomized them into 2 groups. And in scientific world, randomized control trial is something, when you do a new study, it is something which is going to give you the best level of evidence before you pull in multiple RCTs. So that's why we chose this study design. So on one group, we used a standard mannequin for CPR training. And in another group, we used this pillow with the PET bottle low-cost mannequin, which we had come up with for training. And to our surprise, what we found was few parameters were actually better in the pillow group compared to the mannequin as well. So first of all, after training them, we did an assessment. So we've trained, we wanted to see how well they perform on a assessment mannequin. That is, we used a QCPR assessment mannequin. We have a pre-designed standardized app for assessment. So both these groups, and the person who was assessing was blinded. जब उनको पता नहीं था कि ये पिल्लो में ट्रेन किए हैं या CPR मैनिकिन में, both of them, they were blinded assessors who did a independent assessment to see the quality of CPR. So we assessed whether the hand position was correct, and few parameters like depth of compression, rate of compression, chest compression fraction, मतलब कितने देर तक अच्छे से compress कर रहे हैं, recoil, if there is adequate recoil. So the terms which I'm telling are the terms which are necessary for a high quality CPR. So we trained, we assessed all of this, and we saw that the performance was comparable in both the groups. That is, the people who were trained using a standardized mannequin and people who were trained using this low-cost mannequin, both had similar performance in the assessment. And as I mentioned in the beginning, the recoil, the adequate chest recoil, which is mandatory for heart filling between the compression, was better, in fact, better in the pillow group compared to the mannequin group. So we soon will be demonstrating, the WHO CSET team will be demonstrating about how to come up and how to make your own CPR mannequin at home using the pillow. And I'm sure that this would be very helpful for fast tracking and spearheading community training, where probably getting a mannequin was one of the major bottleneck in terms of resources. I hope this will bridge that gap. Thank you so much.
Thank you, Dr. Rachana, and kudos to your team for conducting such an impactful research. And I request Dr. Rachana to guide our WHO CSET team to demonstrate practically how to make a cost-effective CPR training mannequin.
So the things which would require is a pillow, probably an empty water bottle, preferably Bisleri or any of those similar brand of water bottles with the cap, and a duct tape and a pillow cover. That's all is required. So as you can see in the adjacent video, we prefer using polyfiber or rayon fiber pillow that will have a good recoil compared to the cotton. मतलब रुई के पिलो से कंपैरिजन में जो आपको आर्टिफिशियल फाइबर वाले रेक्रॉन फाइबर वाले पिलो होंगे, तो दैट वुड बी बेटर टू गेट अ गुड फील ऑफ द सीपीआर रिकॉइल. उसके बाद हमें चाहिए एक एम्प्टी वाटर बॉटल, 1 लीटर का वाटर बॉटल विद द कैप. तो ये देखिए कि द बॉटल इज कंप्लीटली इन्फ्लेटेड, मतलब जो ऑलरेडी क्रश्ड है वैसे वाटर बॉटल से अच्छा रिकॉल नहीं आएगा. अ गुड फ्रेश वाटर बॉटल विच इज जस्ट एम्प्टी विद द कैप. इट नीड्स टू बी attached to the center part of the pillow, like you can see in the adjacent video, using 2 duct tapes. कोई भी टेप आप जो ब्रॉड टेप है घर में, जो नॉर्मल ब्राउन डक्ट टेप है, उसको यूज कर सकते हैं. सो यू हैव टू अटैच इट टू द center part of the pillow. So normally whenever we do the CPR training, usually we say the hand position should be in the lower 1/3 of the chest. जो बीच वाला जो बोन है हमारा, हड्डी है, छाती का जो हड्डी है, उसका लोअर 1/3 में हम हैंड का पोजीशन के लिए बताते हैं. एंड सेकेंड थिंग इज, सो द बॉटल नीड्स टू गिव दैट सिमुलेशन, सो वी अटैच इट सच दैट इट्स इन द सेंटर पार्ट ऑफ द पिलो. उसके बाद हमें उसके ऊपर पिलो कवर डालना चाहिए. सो यू पुट द पिलो कवर. यू कैन सी इन आवर स्टडी we have made a pillow cover with the human body design so that it gives some more realistic feel. But आप normal वाला pillow cover से भी उसको use कर सकते हैं. अभी to prevent this particular mannequin from slipping, you can either keep it on a firm ground or a mat. So I would suggest to keep the bottle side down, bottle side facing on the ground. Okay, so bottle side नीचे होना चाहिए. This is because when we say the depth of compression should be at least 5 to 6 centimeter या 2 to 3 inches. तो अगर आप बॉटल को ऊपर साइड रखेंगे तो आपको वो रिकॉइल जो है, the feel you'll get it immediately. So the depth of compression may not be adequate. Second thing which you can do is a slightly newer cotton pillow. जो रुई का पिलो है, अगर वो हल्का सा न्यू है और the fibers still have some recoil, that also could be used. So what will happen is the cotton fibers will sit on either side of the bottle, so the stability of the pillow CPR mannequin will be better. So that also is an alternate which can be used. एक बार आप ये कर दे तो then you can choose any of your self-training video modules to learn CPR by yourself. So like the CSET team would be now demonstrating, for starting the CPR, after the initial steps, when you have to start high quality CPR, you lock hands and keep the elbow straight. Okay. So then you perpendicularly position your hand in the mid part of the pillow. On the chest, it would be lower 1/3, and then start compressing. So after every compression, you allow for the adequate recoil, like it's shown. Okay. So the compression will be at 100 to 120 beats per minute. So as you can see, it's being perfectly demonstrated by our CSET team over here. So the hands are locked, the elbows are straight, the compression depth is around 5 to 6 centimeter. This will be reinforced with the click, the bottle click, which you hear after each compression. And you can see there is adequate recoil between two compressions. So these are the 5 factors of a good quality CPR. That is push hard, push fast at the rate of 100 to 120 minutes and at a depth of 5 to 6 centimeters. Okay, minimize interruptions. So between compressions, you can see they are not interrupted much. Allow for adequate chest recoil. Okay, after every compression, there is an adequate chest recoil. Thank you.
Thank you so much to our dedicated WHO CSET team, Dr. Himanshi Bhardwaj, Dr. Kalpana Arya, especially Miss Manvi and Ishani. Thank you so much. Finally, I request Dr. Sanjeev Kumar Bhoi to summarize the key takeaways from today's podcast and discuss the way forward.
So to summarize, CPR should be a mission across the country, regionally and globally, with the concept of saving lives a billion, for a billion population. It is important that we should ingrain CPR in the school curriculum and other academic curriculum, which along with the academic curriculum, CPR should be ingrained in the curriculum of various academic curricula. To take it further, we should also train CPR to the organized groups, besides school kids or college-going students, to the other academia, police, firefighters, and other paramedical staff. It is important, especially in low to middle income countries, to train CPR skills to the local health guides who can go and train villagers across the low to middle income countries and also try to pick up success stories. So that builds up, the success stories will build a narrative among the community that how CPR is important in and how it is playing a important game changer for saving lives in their community or among your relatives. The methodology in this podcast, we also spoke about the methodology of training of CPR skills to the masses. And to the major hindrance of learning all CPR skills has been the acquiring of conventional task trainers or mannequins, which has got a cost attached to it. So one of the innovation model which we developed from the CRO was a pillow CPR concept. The pillow CPR concept was actually started when we did at the peak of COVID. During the peak of COVID, we did it through online mechanism, the pillow CPR concept. And later on, this important concept also was propagated by one of our key colleagues from Southeast Asian region, Dr. Rachana Bhat. She did a scientific study, especially it was the randomized control trial, a clinical trial, where she proved that pillow CPR using pillow, the conventional pillow and customized with a water bottle, to making it simulate or task trainer. So she did a study whether it is not inferior to the conventional mannequins. So she proved it that it can be used as a task trainer, which is available in every household, so that it is not a barrier for learning. So the nowadays proof of concept, and it is published in Resuscitation Plus. And now the question of scalability. The question of scalability here is we can do a multi-centric study on this, maybe nationally. And also I invite my colleagues across the world, especially from the low to middle income country, to participate in this research, which will be also may prove as a game changer for self-learning module, for self-learning across the households of low to middle income country. So with this, let us begin the mission with a vision to save a billion population across the world. Thank you very much. Thank you very much for listening to me and my key messages. Thank you.
As we conclude this enlightening session, I extend my heartfelt thanks to Dr. Rachana and her team for their groundbreaking research, which will undoubtedly save lives and empower communities worldwide. Let's continue to advance CPR education collaboratively, creating a path towards a healthier and more prepared world. Thank you to all our esteemed speakers, Dr. Sanjeev Bhoi, Dr. Prakash Sinha, and my dear WHO CSET team, as well as our listeners, for joining us on this journey. Until next time, let's remember emergency preparedness isn't a choice, it's a responsibility. Let's work together to ensure every community is equipped to respond. Thank you so much.